Having arrived, we will call this meeting to order. We do not yet have a quorum, so we can't officially call the meeting to order until then, but we'll take action on the minutes as soon as we do have a quorum. I'm sure many people are out checking on something else that's going on right now. I hope everybody fared well in the redistricting plan. And, no, I don't think we're going to open it up to commentary. Representative Grinhagen was hoping maybe we'd have a chance for some discussion about redistricting. Not on the agenda for today, unfortunately. What we do have on the agenda today is a report from our legislative auditor. Mr. Nobles, welcome to the committee. If you'd like to state your name, who you represent, and then begin your presentation, we're looking forward to it.
Thank you, Mr. Chairman. And for the record, my name is Jim Nobles. I'm the legislative auditor. And with me at the table is Carrie Meyerhoff, who is an evaluation manager in the Office of the Legislative Auditor, and she was the manager of the evaluation report that we'll be presenting to you today on child protection screening. Mr. Chairman and members of the committee, every day, everywhere in Minnesota, there is a person in a county or tribal child protection agency that is presented with a very difficult task, and that is to review and make judgments about an allegation that a child has been mistreated or neglected in some way. Indeed, the numbers suggest that multiple reviews and judgments are going on throughout the day in Minnesota. For example, in the most recent 12-month period, child protection agencies in Minnesota screened over 58,000 allegations of child maltreatment. While this number is staggering, and certainly could be overwhelming for those who have to do this task, I think we would all agree that every individual review and judgment about a child maltreatment allegation is serious and important. Each review should be conducted thoroughly, and each judgment should be made with great care, because the decision that results in each case can have significant consequences for a child, a family, and a community. For most people, the first instinct to any allegation of child abuse is to intervene, to ensure that a child is safe. However, the people in the county and tribal agencies who screen allegations of child maltreatment cannot act on instinct or emotion. First, they must endeavor to systematically obtain as much accurate and relevant information as possible about what occurred and who was involved. Then they must take that information and measure it against a complex framework of definitions and standards to determine the most appropriate response. That legal framework, by the way, is composed of a wide range of numerous laws, rules, guidelines, policies, and procedures. Some are reasonably clear, but others are not. So we have to say that the child protection screening process is not just serious and important, it's also complicated and difficult. There are two principal concerns that triggered our evaluation of the child protection screening process. First, there is concern among some people that data about child protection screening in Minnesota suggests that Minnesota has been screening out too many allegations of child maltreatment. Second, there is concern about variation in how local child protection agencies interpret and apply the laws, rules, and guidelines used in child protection screening. We considered both of these concerns and others in our evaluation, and we used several methodologies to address them. First, we analyzed data, a lot of data. But it is often important to look behind the data, and even beyond the data, particularly when there are questions about its validity and reliability. So we did not take the data at face value. We asked a lot of questions, and we probed behind the data to test its reliability and validity. We also conducted site visits, interviews, and surveys. In addition, we designed several vignettes describing facts and situations that are often contained in child maltreatment allegations. And we asked child protection agencies to review the vignettes and tell us what judgments they would make in response. As you can see, you have in front of you the results of our work, a 90-page report. Nevertheless, we know that there are important issues and concerns and questions that we were not able to address about child protection and certainly about the state's child welfare system. We also know that we are giving you in this report a mixed report card on the part of the system that we did evaluate, the child protection screening process. Our report provides you with information and our assessment that gives you reasons for reassurance as well as concern. You can be reassured that there are many people, serious-minded, thoughtful professionals in child protection agencies in both counties and at tribes who are working hard to make appropriate decisions under very difficult circumstances. But we also found reason and room for concern, particularly in the legal framework by which people make their screening decisions. And so we make some recommendations for greater clarity as well as others. And so, Madam Chair, if I could now ask Ms. Meyerhoff to make a more detailed presentation of our reports, what we found and what we recommend. And we certainly will be here for any questions that you might have. And thank you very much.
Members, thank you, Mr. Nobles. Members, we do have a quorum, so we'll officially call this meeting to order. And with that, Ms. Meyerhoff.
Thank you, Madam Chair and members. For the record, my name is Carrie Meyerhoff with the Legislative Auditor's Office. And I'd like to acknowledge my co-workers on this evaluation. They were KJ Starr and Matt Schroeder. KJ is seated behind me, but unfortunately Matt could not be here today. I'll begin by reviewing with you our overall findings before getting into the details of our recommendations. First, we found that the child protection agencies in Minnesota do vary in their screening decisions, and we identify several factors that we think contribute to this variation. But overall, we concluded that the county and tribal child protection agencies administer child protection screening adequately. They do a reasonable job of this task. We found that the Department of Human Services has provided a number of resources that assist agencies in their screening decisions, but we do think there's more that the department could do. So I'd like to take a step back and talk a little bit about what is child protection screening. Child protection screening is really a single decision in this range of child welfare services. It requires that a child protection agency analyze the information in a maltreatment referral and compare the allegations in the referral to criteria in state statutes, rules, and guidelines to determine if that maltreatment report requires a child protection response. If they conclude that it does, they will screen it in and respond with either an assessment or an investigation. Now, these child maltreatment referrals that they are screening allege physical abuse, sexual abuse, and or neglect of a child by a person responsible for the child's care. And for the purpose of our evaluation, we focused on alleged perpetrators who are functioning within the family unit and responsible for a child's care. This focus allowed us to target our efforts to evaluate county and tribal child protection agencies. And these are typically the human services or social service agencies, of which there are 86 in Minnesota. In a recent 12-month period, these agencies recorded over 58,000 maltreatment referrals. 3/4 of these came from mandated reporters, and those are individuals who are required by law to report when they know or have reason to believe that maltreatment has occurred within the previous 3 years. They include professionals in fields such as healthcare, education, law enforcement, and others that are listed in statute. Now, under Minnesota law, anyone can make a report of child maltreatment. And in this 12-month period ending March 2011, 25% of those referrals came from voluntary reporters. In 2010, these child protection agencies screened out 68% of the maltreatment referrals that they received. When an agency screens out a referral, that means they have concluded that the allegations do not meet criteria for a child protection response. But they may respond in some other way, or they may do nothing with that referral. We thought we could look at these data to get a better sense of what they could tell us about screening practices, and instead we concluded that they may reflect actually data entry practices. What you see here is data that the Department of Human Services has reported to the federal government since 1999. And we have added to this at the far left, in 1996, an estimate of the screen-out rate based on data that are reported in our 1998 evaluation on this topic. And what you see here is a 68% screen-out rate in 1996, dropping to 38% in 2000, and increasing again to the 68% we see today. We think this more likely reflects data entry practices because that 38% coincides with the first year these data came from the Social Service Information System. It was a new case management system that was just introduced the previous year. And in fact, if you look at the numbers under these rates, you can see that the screened in referrals over this time period have stayed relatively constant, between 16 and 20,000 a year. In contrast, the number of screened out referrals has fluctuated quite a lot, really mirroring that screening rate. And again, with that low point of 10,000 screened out referrals occurring that first year from the new information system. So instead of relying on these data to draw conclusions about child protection screening, we turn to the agencies that actually do the screening. And we in fact found that the agencies vary in their screening decisions. We sent agencies 10 fictional vignettes that we asked each agency to screen. These were depicting scenarios where we thought we would find variation if there in fact was variation. They're called gray area referrals. And we found that the agencies were not unanimous in their screening of any of the 10 vignettes we sent them. 3 of them sort of fell into a category that we thought there was pretty high agreement. 80% or more of the agencies agreed on the screening decision. So for example, 82% of the agencies screened in a referral of a new mother testing positive for marijuana at the birth of her child. Another 3 vignettes fell into sort of moderate agreement, where 60 to 80% of the agencies agreed with the screening decision. So for example, 64% of the agencies screened out a referral of domestic violence when the children were home but were not present in the room where the violence occurred. With the remaining 4 vignettes, there was really divided opinion, with fewer than 60% of the agencies agreeing on the screening decision. So, for example, 54% of the agencies screened in a referral of a 5-year-old child found wandering a block from his home. And all of the vignettes that we sent the agencies and their screening decisions are in the appendix to the report. We identified several factors that we think contribute to this variation. And the one we really spend the most time talking about in our evaluation is agencies' perceptions of risk. And what we mean by this is when do agencies determine that risk of harm or risk of maltreatment is a child protection issue? There seem to be really different perceptions among the agencies about when that occurs. And in the report, we discuss this in the context of neglect referrals and also referrals that allege threatened injury. Now, one type of referral that alleges threatened injury are those that include domestic violence incidents. Threatened injury requires a substantial risk of physical abuse, sexual abuse, or mental injury. And when agencies decided that domestic violence referrals presented a substantial risk varied, with 18% of the agencies saying they often or always screen in referrals of domestic violence when children are within sight or sound of the violence. In contrast, other agencies seem to require a more definite presence of the child in the room or near the incident when the domestic violence occurred. Now, we identified several other factors, but in the interest of time, I'll just talk about one other. and that is the extent to which agencies use information external to a referral when they're making a screening decision. Through a process called intake, child protection agencies gather as much information as possible from reporters of maltreatment. They also fairly commonly will look in the social service information system to see what else they can find out about the family and other family members. They're just trying to get a really complete picture of the family and the circumstances. But we observed that some agencies were willing to go even beyond that and contact people beyond the original reporter of the maltreatment to try and find out more about the child or the family. So, for example, calling a child's teacher to find out if the teacher had any concerns. And the extent to which an agency has additional information could influence the decision that they make when they make that screening decision. So besides looking at the variation in the screening decisions, we looked at the practices overall of agencies. And as I said, we concluded that we think they do an adequate job administering intake and screening. In 62% of the agencies, social workers with specialized skills are completing that intake task that I just described to you. And when we surveyed pediatric healthcare professionals and school personnel, most of the surveyed mandated reporters thought that the child protection worker they spoke with on their most recent referral was professional and asked good questions. Now, that doesn't represent every agency in the state. They hadn't made reports to all the agencies, but we thought it was a good sign that the agencies, for the most part, are adequately carrying out intake. And we also concluded that screening decisions, they often involve multiple staff and a very careful consideration of the allegations in a maltreatment referral. The fact that these decisions often involve multiple staff, we think is a good practice because it minimizes the impact that an individual's biases or emotions could affect the screening decision. Now, our one concern with the screening process is that about 10% of the screening decisions appear to occur beyond the 24-hour period required by law. We discuss in the report that this may just be reflecting, again, data entry practices or procedures of when they enter screening decisions in SSIS, but we do think this is something that agencies should pay attention to and make sure they're making decisions within the 24 hours required by law. Now, turning to the resources that the department provides, the department has published the Minnesota Child Maltreatment Screening Guidelines. These were developed in collaboration with county and tribal child protection agencies and others. And 98% of the screeners said that they consider these guidelines when they're making screening decisions. At the same time, they said there were some sections of these guidelines that they thought could be improved and clarified. And we recommend that the department continue to work with these agencies to make these useful guidelines for everybody. The department has also created training on intake and screening. And unfortunately, this curriculum was being pilot tested during the course of our evaluation, so we could not ask agencies what they thought of it. But we took the training, and we thought it covered many important issues in the types of questions to ask in intake, how to check your own biases and perhaps the biases of people making reports, and an introduction to the state screening guidelines. We do recommend that the department expedite its plans to make the web-based training modules available so that all staff who perform intake or screening can take this training. The department hosts quarterly regional meetings, and 3/4 of the human services directors told us that these have provided a valuable forum for discussing screening decisions. But at the same time, they said they would like more opportunities to practice and discuss screening. So we recommend that the department consider using at least maybe one of these meetings a year to focus on screening and address screening issues and questions that agencies have. And finally, the county and tribal child protection agencies are responsible for keeping mandated reporters informed on the definitions of maltreatment. But the Department of Human Services has developed some resources that agencies can use. And about 90% of the human services directors told us that these resources have been helpful to them in fulfilling this responsibility that they have. So beyond those recommendations that I just kind of covered related to the department's resources, there are a few others I would like to cover. First, for the legislature, We recommend that the legislature direct the Department of Human Services, working with child protection agencies and others, to propose statutory language that would clarify the policy on when risk of harm and neglect become child protection issues. As I discussed earlier, that was one of the factors that we identified as contributing to variation in screening decisions. This second recommendation is kind of unrelated to anything I've talked about up to this point, but the section of statute that we're talking about, the reporting of maltreatment of minors, does not distinguish between all referrals that come into an agency and those that an agency screens in. But there are provisions in that law that I think pretty clearly just apply to the screened-in referrals. And we think making this distinction in statute between all referrals and screened-in referrals would help to clarify some of those provisions throughout the Reporting of Maltreatment of Minors Act. And third, we think that the legislature should consider amending state law to clarify some data privacy issues. So, for example, right now there are minimum retention dates for child protection records, but there are not dates by which agencies must either destroy or seal those records. And they don't address the screened out referrals at all. So in combination with the previous recommendation, this would be an opportunity for the legislature to say what is the status of those screened out referrals and how long should those be kept. And we have a couple of additional recommendations for the Department of Human Services. We suggest that the department promulgate some rules that provide additional guidance on screening practice. We don't intend for these to be really prescriptive, black and white in every circumstance types of rules, but we think some basic guidance. For example, can agencies consider the credibility of a reporter when they're screening a referral? The details could be spelled out through the guidelines or training or technical assistance, but just some basic standards in the rules we think would be a good idea. And finally, we suggest that the Department of Human Services and the county and tribal child protection agencies work to improve the usefulness of the data on child protection referrals. We think they could be a source of good information if there were a more common understanding of what a maltreatment referral is, if there was some assurance that agencies were entering all their screened out maltreatment referrals so that really true comparisons could be made among agencies and over time. And with that, I can conclude my presentation. So thank you.
Very good. Thank you for your presentation, both of you. Members, we've got the meeting called to order now officially, and with the quorum, we also need to move on minutes. So before we open things up to questions here and additional testimony, Representative McDonald or Representative Grinhagen, do you want to arm wrestle, see which one gets it?
I wouldn't think of arm
Okay, Representative McDonald wins. Representative McDonald moves the minutes of February 15th. Any questions? Seeing none, all those in favor signify by saying aye. Aye. Those opposed, motion prevails and the minutes are adopted. And we are now back to questions of either Mr. Nobles or Ms. Meyerhoff. And then we have some additional testimony from some other people who've come here today on this report. Mr. Nobles, if I could ask, is there legislation being prepared to implement the recommendations of your office, or is this something that would be done through rulemaking?
Mr. Chairman and members, it is not automatic that we have a member of the Legislative Audit Commission prepare and sponsor legislation to implement our recommendations. It's really been the practice of the Legislative Audit Commission to have us bring these reports to committees like we are today, where there is the real expertise on some of these issues, and there is jurisdiction. And so I think in the first instance, the Legislative Audit Commission would like to see if there are some of you that would like to pick up on some of these recommendations and go forward with them. Over time, if that doesn't happen, then we go to members ourselves and seek sponsorship. But again, in the first instance, we'd like to look to your response. I know that you just received this report just a short time ago, and so it's probably going to take some time on your parts to digest both the findings and recommendations and see exactly what direction you want to go.
Members, questions? Representative McDonald.
Thank you, Mr. Chair. I came in a little bit late, so if I missed the presentation as to why there was only 84 counties in the study and instead of the 87, I apologize, but that is my question.
Mr. Chairman, it is
Mr.
a good
Nobles.
question. There are some counties that have joined together to have joint human service departments or divisions. And that's actually something that has been attempted over time in Minnesota for many, many years. As you well know, we have 87 counties, and they have a great deal of difference in terms of the population and the capacity and a lot of things. And so over time, the legislature has attempted to encourage, but not force, some counties to join together and have joint human service offices. My recollection is it's Lincoln Lyon. Others could probably help me here. I think they have a joint one. But that's the reason why there are not 87 separate human service and child protection agencies.
Mr. Nobles, I think it's Lincoln, Lyon, and Murray counties that are
Murray.
doing this jointly. So,
Yes.
follow-up, Representative McDonald, or
No, thank you, Mr. Chairman.
Representative Grinhagen?
Hey, thank you, Mr. Chair. Ms. Meyerhoff, hey, thank you for your testimony and your work. And, you know, this is one of the very difficult area to work in, you know, child protection. And none of us want children to be abused. But I've got a little bit of experience with this, not firsthand, but mostly secondhand from being a school board member for a number of years. One of the things, you know, I see two things in your report. One is a policy, a clarifying policy on risk of harm and neglect, and then also distinguishing between all referrals and screened-in referrals. And, you know, one of the things I've seen, not rampant, okay, but it does come up from an observation standpoint. And again, I don't work in the area directly, but I know people who do. And having been on the school board, you know, schools are mandated to report abuse immediately if they believe there is abuse. Sometimes there seems to be an assumption of guilt on the people who are accused rather than innocent until proven guilty when there's a complaint about abuse for children. Do you believe that clarifying the policy on risk of harm and neglect might help that area as far as, you know, local social workers that respond to accusations of abuse?
Ms. Meyerhoff?
Thank you, Mr. Chair and Representative Grunhagen. I don't know that those recommendations would help in the types of situations that you're talking about where it's at least the perception that social workers are assuming guilt. I think the screening that we saw involved a really careful and deliberate consideration of the allegations in a referral and whether they met the criteria and statutes and rules. And so our recommendation about clarifying neglect and risk of harm is to help clarify when is it appropriate to screen in a referral that alleges one of those things, but I don't know that it would get to what you're talking about, Representative Grun.
Representative
Follow-up
Grinhagen?
question. Thank you, Mr. Chair. Just a follow-up question, too. The other thing I've observed is there seems to be a graying of the lines in terms of parents' ability to spank a child. It is legal to spank a child yet in this state, but at times it seems like social workers project a philosophy that any type of spanking is illegal. Would clarification in the risk of harm regarding spanking help in any way?
Ms. Meyerhoff?
Mr. Chairman,
Noble.
Representative Grunhagen, you know, I think what we are presenting to you is a range of possibilities on where you want to, in law, intervene in the legal framework. And if you think that's an area that needs clarification and you think that's an appropriate role for the legislature, we think that is certainly your prerogative. Addressing more broadly, though, your first question, but I think it's connected to your second. I mean, we certainly recognize that there are people who, and many of whom, as Ms. Meyerhoff went over the data, most of the reports, allegations do come from mandated reporters. And so I'm sure there's a range of response on their part. Some people feel that since they are a mandated reporter, they need to report everything. Others think that there may be a judgment on their part as they see something to make some determination. So there's probably a range, and I think you might be referring to, at that level, that there may be some bias and some presumption on the part of a reporter that, yes, indeed, there is abuse or maltreatment. And I think that may be reflected in the fact that, as we said, there are over, in the last time period we looked at, 86,000 reports of maltreatment, and yet many of those are screened out because it does take a judgment on the part of people who are looking at the law and not just going on their instinct or their impulse or emotion or their bias, but they should in fact look to the law, to the rules, to make that determination. We certainly recognize, and I think it has to be emphasized, that even though there may be an impulse on the part of all of us to err on the side of protecting the child and responding to an allegation, I do think we have to keep in mind that that intervention is by government into a family situation. And so I think very definitely it has to be a very disciplined and appropriate intervention based on the facts as best they can be determined and measured against the law and the rules.
Very good. Just Representative Grunhagen.
One more follow-up. No, I believe that spanking is appropriate, age appropriate is good. My dad sure believed in it, let me tell you. And believe it or not, I was even spanked on a school bus by the school bus driver one time. And he happened to be a deputy sheriff in the county. And and by the way, I deserved it. I was being mean to one of the girls that was on the bus with me. But anyway, the other thing I just say is this, is while I was on the school board, an issue came up. And this, I guess, is most disconcerting to me, and I don't know to what degree that you can address it. And by the way, there's lots of good social workers doing lots of good work, necessary work. And I was on a school board with social workers. I got friends who are social workers. And, you know, I know they're good people. They want to do what's right, okay? But we had a curriculum that was entered into the school, our public school, without school board consent and without parental notification. The name of the curriculum, and it came from the Humphrey Institute at the time, was My Family and Me, Violence Free. And what they did, and it's been a few years, but I believe it was at the 6th grade level, when students came into the classroom, they were given questionnaires about what was going on back at home. So without any physical reason for thinking or possibly believing there was abuse for children, it seemed like the whole class was medicated and the social workers were actually looking for problems in the family. So again, the name of the curriculum was My Family and Me, Violence Free. I renamed it at the school board meeting. I contested the curriculum. I renamed it My Family and Me, and the social worker makes 3, okay? Because that's what seemed was going on. From your audit, are these types of curriculum being promoted into the school district, actually looking where you medicate the whole classroom with questionnaires about what's going on at home?
Mr. Chairman, Representative Grunhagen and members, we did not go into what is happening in schools in terms of curriculum and family relations. Our focus was really on the referrals that go to the child protection agencies and how they deal with them. What other things are going on in schools or churches or elsewhere that might influence people to make reports was really beyond what we looked at.
Thank you.
Okay, I have Representative McDonald. I do wonder if perhaps what we could do is, I know we have Aaron Sullivan-Sutton from the Department of Human Services here, Assistant Commissioner, and some others to respond to the report as well. Maybe we could have them testify and then continue with their line of questioning. So I'd like to invite Ms. Sutton, Ms. Sullivan-Sutton, I'm sorry. I should use your full name. Assistant Commissioner, Department of Human Services, welcome to the committee again.
Thank you, Mr. Chairman, members. As indicated, I'm Erin Sullivan-Sutton. I'm the Assistant Commissioner for Children and Family Services at the Department of Human Services. And thank you for giving me the opportunity to speak with you for a few brief moments this afternoon with respect to the audit conducted by the Office of the Legislative Auditor. I would start out by first commending the Office of the Legislative Auditor, Carrie Meyerhoff, and their colleagues. They did, I think, an incredible job of grasping a very complex system that's administered by 84, or actually 86 different entities in Minnesota. Minnesota is one of, I believe, 11 county-administered child protection systems. And we agree with many of the recommendations and findings, and I'll go through them in a moment. But we do appreciate the time and effort of the legislative auditor in looking at this area. This is an area of social work practice that we have worked with counties diligently on in the past many years to try to improve services, consistency across outcomes, but also improve services and outcomes for children and their families throughout the state of Minnesota. I think it's important to note that in addition to some of the areas of concern that Ms. Meyerhoff noted, that the good news is that 98% of the county respondents indicated that they are following the state screening guidelines. We have worked with the counties over the years to try to provide the necessary tools, resources, and information in the hands of the local agency staff so that they have the best information to make the daily decisions that they are required to make on a daily basis. So as was indicated, we developed the statewide screening guidelines that are available on the web. We've provided informational guides for mandated reporters, including making web-based mandated reporter training available on the DHS website and informing all of the various licensing boards across the state about the existence of that training and encouraging them to have members participate in that training. We have also provided web-based curriculum for child protection workers and continue to work on consultation and technical assistance. This is an area that is very important to us, and we believe continued attention to continuous improvement is very important. We support many of the recommendations for additional statutory guidance that was pointed out by the audit. We agree that the statutes should be amended to provide a clear distinction between what is a referral to child protection and what is an accepted report of child maltreatment that results in either an assessment or investigation. That's an important distinction for the public to be aware of. We also concur that when referrals are screened out from receiving a child protection response, that the state law should clearly identify what information should be maintained concerning those reports so that we're ensuring consistent protection of data about individuals, regardless of what county an individual lives in. We also believe that the recommendation to have a definitive timeline be established for destruction or stealing of child protection records is a good idea. Historically, the focus has been on what is the minimum period of time that a record can be maintained, but I think the audit also highlighted the importance of having records destroyed at some point in time. There are a number of other issues that I think are a little bit more complex that were pointed out that we believe are very important to continue to work with the tribes and counties, possibly legislators and others, but are not sure of the exact solution. I think the area of one of the things that we are committed to doing is including regular consultation and technical assistance, including continued broad access to web-based training and supporting regional best practice forums, as was indicated. We believe it's important to explore with Minnesota counties and tribes the best method to clarify consideration of risk of harm in child protection and child protection screening and how we define what constitutes necessary care. I think the balance to be struck is to make sure that we are not casting the net too wide, that we're bringing in children and families that are not warranted in the child protection system, At the same time, we do not want the net so narrow that we, in fact, leave children in unsafe circumstances. But we believe that those are very important issues that warrant continued dialogue. We also think that it's important that we work with counties and tribes to assist in monitoring the timeliness of screening decisions. As Ms. Meyerhoff indicated, the 24 hours is the time period that decisions should be made one way or the other. And we believe it's important to do more work on monitoring the accuracy of data entry and documenting those decisions. And this is an area that we are look forward to working with counties to make improvements that I think were warranted, as noted by the auditor. We also will explore with counties and tribes anything that we can do to increase their outreach to mandated reporters and ensure that community professionals have the information they need to be informed reporters. And this is an issue, of course, that is necessary across the state. But again, we believe that one of the things that the audit did point out is that there actually is more consistency than we might have seen, although we do see areas that need improvement, and we welcome the attention and the recommendations of the auditor.
Thank you, Ms. Sullivan-Sutton. Members, questions? Okay. Hopefully you'll stick around, maybe sit right behind the testifying table so we can ask questions as we go along. And next up we have Julie Ring, who's the Legislative Coordinator and Health and Human Services Policy Analyst for the Association of Minnesota Counties. Welcome to the committee. And is this Stacy Hennon with you? Very good.
We're a duo today, Mr. Chair.
Very good. State your name for the record and who you represent, and then proceed with your testimony.
Sure.
Welcome.
Good afternoon, Mr. Chair, members of the committee. My name is Julie Ring, and I'm the Health and Human Services Policy Analyst for the Association of Minnesota Counties. I won't say my whole title. We had to print bigger cards to fit that thing on there. I'd like to first, as Ms. Sullivan-Sutton did, thank the Office of the Legislative Auditor for their willingness to seek county input throughout their process. We think that the input that we were able to provide throughout provides for context for some of the information and results in a richer report for you to review. Overall, we believe that this report is a fair and balanced review of the child protection screening process. It demonstrates the complexity of this work. And we did include a letter in the report. It's at the very end of the report, I think on page 97, that you can refer to. We're going to go into a little more detail than that today, but not much. So you have those comments to reflect on as well. Counties take our responsibility for child protection work very seriously. We devote significant effort and significant resources to this work. And for that reason, I'd just like to take a moment to draw your attention to page 14 of the report as well in figure 1.2. This chart shows, I think, in relatively simple fashion, that for about every $100 spent on child protection, child welfare work in Minnesota, counties contribute $57, the federal government contributes $27, and the state contributes $10. Child protection work in Minnesota is overwhelmingly paid for by county tax levy. As a result, if you as legislators decide to move forward with legislation or work in this area, or if you charge DHS with doing so, we would hope to continue to be a partner at the table with you as you make decisions. As you can see, we're not only the primary provider of this initial work, but we're also the primary payer for it. And that's my opening comments, and with that, I'm going to turn to Stacy Hennon, who will provide you with more details about the findings in the report.
Thank you. Ms. Hennon, if you could introduce yourself for the record, your name and who you represent, and then proceed.
Thank you. I'm Stacy Hennon, the Director of Grant County Social Services and the Chair of the MAXA Children's Committee. I would agree that the Office of the Legislative Auditor did an admirable job of seeking input and feedback from counties in a variety of different ways, and they worked with a broad range of counties, from small to medium to large. We felt it was important that as many cultural and geographic areas of the state be looked at, and the OLA took on that task wholeheartedly. As a result, we believe you see a more accurate picture of the strengths and needs in Minnesota's child protection screening process. There are a couple points that we would like to make regarding the details of the report. Overall, we felt the report was fair and balanced, and it was obvious that the OLA took seriously their responsibility to present a comprehensive overview of a very complicated program. We want to provide you with an additional perspective on some of the recommendations that were given to you in the hopes that we will continue to approach the human service delivery system in a way that promotes best practices and allows us to change fluidly to keep up with those best practices for our clients' well-being and safety. The report recommends a variety of statutory changes and promulgation of rules. While we understand concern about correcting any inconsistencies among counties, we do not feel this would be the most appropriate method of improving consistency. Statutory changes in rulemaking can be an administratively complicated process, and then time entailed in the process would likely prevent us from being able to respond quickly to the best practice trends and changes in federal law. We recommend that counties and other stakeholders work collaboratively with the Department of Human Services to standardize screening guidelines. If the statute needed to be changed, there would be a time lag, and it would not be as flexible of a process as if it was guidelines and as if it was guidelines. Guidelines allow us the flexibility of changing as trends, federal law, and related statutes change. We feel it's imperative that the counties and DHS work together in this process to ensure that best practices remain a priority and consistency is established statewide, while also considering the differences that are there for a reason, whether it be cultural or socioeconomic. We found in the vignettes that were done that it is the gray area reports that have the most discrepancy in screening amongst counties. Community standards and cultural differences likely play a large part in that. When evaluating the imminent danger and serious harm reports, you do not see wide discrepancies between counties. That seems to be a more clear-cut area. The report points out that the primary source of funding for child welfare programs is county levy dollars. This factor potentially contributes to some of the inconsistencies seen statewide. Since this activity is primarily funded by county dollars, there will be variations based on the county's ability to pay for the work as well as the individual county's priorities. If counties make the major financial investment, we believe that counties should also have some authority to decide how the programs are implemented within the parameters of the requirements of the programs and with best practices in child safety at the forefront. Both the state and the counties believe that consistent practices are of critical importance. Towards that end, we also believe that a fair balance of funding by the state and counties is an important goal. Counties currently can individualize their priorities to reflect community standards as long as they are meeting the requirements. The state contributing more money to child welfare would allow them more input into how the dollars are spent and potentially create a more consistent program if that is the goal. We appreciate the work that the OLA did on gathering input from a variety of stakeholders and agree that professionals who are mandated reporters are a valuable part of the child welfare continuum. We would agree that we need to continue to reach out to those populations and work on ongoing and continuous training and education related to mandated reporting responsibilities. We would like to note that only 2% of the survey responses characterize their relationship with counties as poor, and those appear to be more situational opinions, not factual accounts of incidences or occurrences. Counties work hard to establish appropriate professional relationships with all mandated reporters, and we feel our success in that area came through for the vast majority of this report. The last point that we would like to make is not solely related to the contents of this report, but to the child welfare field in general. While we have focused on the statutorily required aspects of child welfare and child protection specifically, it is important to not underestimate the critical importance of preventative work and interagency collaboration. Early intervention and prevention community-based services are equally important to preventing child maltreatment. And while we must focus on the children currently in our child welfare system, we need to focus equally hard on the children that are on the cusp of our child welfare system. Adequate preventative funding and the development of interagency relationships with educators, healthcare providers, and family service agencies will always be critical to high-risk families and would maintain more children safely in their homes in the long run. The child welfare continuum does not begin or end with child protection. There are a variety of other services that weave into child welfare to create safe families, and focusing too much on reacting and not preventing is a product of our current fiscal state and can have serious repercussions for children and families. Once again, we appreciate the manner in which the OLA approached this subject and their openness to our involvement. As in the past, the OLA's professionalism and well-established legacy of producing excellent reports lends credibility to this legislative report. On behalf of MAXA, I want to thank you for the opportunity to assist in this process, and we would be happy to answer any questions. Thank you.
Thank you, Ms. Hennon. Members' questions. I know one I'd like to throw out to both all three actually, the auditor, the department, and the counties, is we are one of 11 states that have a county-based child protection system. is that still appropriate, kind of big picture? Is it best run by the counties? It seems to be going pretty well based on the auditor's report. Or do we think we need to do something different there? And, you know, any or all of you want to weigh in on that question, I'd be interested in your input. Ms. Sullivan-Sutton.
Mr. Chairman, members, I think that is the perennial question. I think one of the things that I often tell my colleagues in other states is, although we have 84 or 86 different systems, in many respects, we have been able to make the changes, significant changes in our child welfare system in Minnesota because of the county administration. I've often said it's sometimes easier to move 87 small boats than one large ship. And I think if you look at child welfare reform across the country, the county-administered states have really been in a leadership role, although some state-administered systems have done some significant reform. But the county-administered systems, I think, have been able to move further faster.
Very good. Ms. Hennon?
We would agree that the county-administered system performs well in overall standardized performance, and we think that it allows also for those cultural and geographic differences to be taken into consideration, too. So we would agree that it's county-run system is better.
Thank you. Members, other questions?
Yes.
Representative McDonald.
Thank you, Mr. Chair. On the page, on 48 of the report, in dealing with source of referrals, I noticed that some counties will allow involuntary reporting and some counties do not. Well, they'll do anonymous reporting. So I'm just curious, oftentimes in cases a family member will report a referral but wants to remain anonymous. And I noticed that in your report some counties do not accept anonymous reporting, but some counties do. So I'm just wondering, where in the law is there a discrepancy or interpretation that they're not understanding? Is that one of the referrals that needs correction?
Mr. Chairman.
Ms. Sullivan-Sutton.
Representative McDonald, this was actually an issue that was addressed by the Minnesota Supreme Court many, many years ago, involving an anonymous report made in, I believe, Hennepin County. And the Supreme Court at that time said that the agencies were to take anonymous reports if the information otherwise met the criteria in the statute.
Mm-hmm.
Representative McDonald.
Okay, thank you, Mr. Chair. Thank you for that comment. It still, unless I'm reading the report wrong, it still gives counties the latitude to either not accept an anonymous call, screener, or to accept it. There still seems to be some confusion there amongst different agencies.
Mr. Chairman,
Ms.
Representative McDonald, yes, I think that that's an area that the auditor has pointed out needs to be clarified so that there is consistency, because it's not being handled consistently by the counties at the present time.
Ms. Meyerhoff, did you want to weigh in on this too?
I'd just like to make one comment, Mr. Chair and Representative McDonald. There is a section in statute that says a report must contain the name and address of the reporter, or something to that effect. And so some agencies are seeing that language in law and saying, well, we can't take a referral unless we have the name and address of the reporter. So maybe that could be clarified in the statute.
Representative McDonald, I see an opportunity to put your name on a bill.
It seems to be, yes. I will get right on top of that.
Okay, we have other people more in the public testimony category who have signed up to testify here this afternoon. We want to give them some time as well, but as you have questions, Representative Quam, I would ask our other testifiers to stay close just in case we have additional questions.
Thank you, Mr. Chair. That brings to mind that there are certain exceptions in statute for, say you're voting and you're in a battered spouse facility and your address is protected information. Are there any, allowances that way to, that are in statute for this reporting? Or I'm just curious, because this brings up a point of where someone could be in there and maybe they aren't going to anonymously, they want to, come forward, but actually their address would be protected under statute.
Can any of you help us with that? Mr. Nobles?
Mr. Chairman, I was sent up because no one else knows the answer, nor do I. But I think, again, you hit upon something that we will certainly research and see if that's an area that needs clarification. We will get back. Thank you.
Thank you. Representative Quam, any follow-up? Okay, I have next up for testimony Richard Gehrman, who's from Safe Passage for Children of Minnesota. Mr. Gehrman, if you keep your testimony to about 3 minutes, that would be good.
Thank you, Mr.
Okay.
Chair. I'm Rich Gehrman. I'm the Executive Director of Safe Passage for Children. We're an advocacy agency working on child welfare reform.
Well,
I appreciate as well the legislative auditor's work on this, and it's good to hear many of the positive findings and recommendations. I think we've had a very short time to review the report, and so we'll be following up with many of you, of course, but just a couple of things that I think are important takeaways from this. First of all is in this area there was some difficulty in trying to find data that was consistent across counties. We find that to be true across the entire child welfare continuum. And I think it points out an opportunity to continuously improve and build the high performance of the system by getting better data. That's really critical. You can't hold people accountable or see where you need to improve without data. And I hope this is the start of a conversation about how that can be improved across the continuum. I think there also is an issue that we've seen in our work about consistency with how different counties work with families and what they screen in and what they don't. And taking into account cultural differences and community and so forth, I still think there's a wide variation in kind of what counts as abuse or neglect across the state, and that's something that's important to address for the safety of children and the well-being of children. And I think one other comment is I think one thing I did expect to see in this report, which I didn't, was some discussion about older youth. I sat in on one of the discussions that the legislative auditor had with about 40 people from youth shelters and programs for homeless youth, and there was quite a bit of discussion there, as well as some conversations I've had with school social workers recently that once you're above a certain age, counties are not going to at least some counties are not going to screen you in no matter what the circumstance, and that age is down around middle school. So I'd hope to see some findings along those lines. Was disappointed not to see that included. So those are my basic comments. I think the data is really the important thing to ensure consistency and that we improve our performance over time. Thank you.
Thank you very much. Members, any questions to the testifier? Representative McDonald has a question.
I'm sorry, Mr. Chair, it's actually not necessarily to the testifier. It's to Mr. Nobles or someone from the department. Is this appropriate?
Sure, yeah.
Or should we wait for...
We're all here to... Mr. Nobles?
Yes.
Thank you, Mr. Chairman.
Representative McDonald.
Ms. Knowles, in your findings, was there any evidence of... I see on the page, also on page 48, about mental injuries. The staff, it says that some staff stated they generally do not screen any mental injuries unless it comes from a mental health professional, which is understanding. So my question is there any findings of kids that were mentally abused verbally, not physically? They weren't neglected, they weren't maltreated, but they were physically abused because of anger issues of the parent. So is there any indication of that? If that's the case, I'll just stop there. Is there any indication of that in your findings?
Mr. Chairman, if I understand the question, I think it goes to that question of is this issue treated consistently? And I think the answer again would be no. I think that you would find some variation to the degree to which people consider that kind of activity, abuse or not abuse. Some would think that it could cause some mental harm. Others may not. So, again, I think it is one of those areas that is left for some amount of judgment. And again, I would come back to what we said a number of times. I think that the parameters of what is considered child maltreatment does start with the law. I do understand and accept that there needs to be some amount of flexibility so that people out in the field and the counties can apply the facts as they can best determine them. But I think if you look at the laws and find that you think there is some ambiguity or some need for greater direction, clarity, broadening or tightening of this area of potential mental harm, I think, again, that's the prerogative of the legislature to deal with that. So I don't know if I fully responded to your question, Representative McDonald, or not, but maybe you want to try again if I didn't.
Representative McDonald?
Mr. Chairman, thank you. Mr. Nobles, you did, indeed. Although it's important that we as government not necessarily meddle in the affairs of families. So I think there's a fine area that we need to be careful. But as far as verbal, mental abuse to children, harsh anger problems, I think that we have a responsibility to address that. And if it's not anywhere in law, then I think it ought to be. Because that's almost just as damaging to children as a physical abuse. And I mean really harsh anger, mental abuse to children. And if it's nowhere in law, I think that we should, as this committee, seriously look at that.
Mr. Chairman, I think I would just expand a little bit, but I know you have others you want to hear from. You know, I think one of the great challenges with all of the issues that are being talked about, and this is certainly one, is that the child protection agency worker who is dealing with this has to depend largely on a report that comes from, well, they would always, I assume, deal with a report that comes from somebody other than themselves. They weren't there. And so, again, it goes to that question of, do they have adequate facts, credible information enough to make that determination? So it all starts at the reporter level, what was actually seen, what was observed, how it was communicated to the agency that has to make that judgment. But so there are just many, many complexities here, but I'm sure that many of the people who work in the area of child protection would agree with you that a great deal of harm can be done to children by anger and mental abuse.
Okay, very good. Mr. Gehrman's testimony reminded me of another thing, too, and that's that the chair understands that the public has not had a chance to do a lot of in-depth review of this. I think that's come up a couple of times. We haven't had a whole lot of time to dig through this in depth, and so if anyone else who isn't signed up to testify here today is looking through this, has additional testimony they want to, or comments they want to forward to the committee, at a later date, you can send those to our committee administrator, Holly Iverson, and I'll give out her email address here, holly.iverson, Iverson, at house.mn. And that written testimony can then be distributed to committee members. So we recognize not everybody's had a chance to digest this or provide meaningful testimony just yet, but we want to provide that opportunity in the future. With that, we also have Charles Dixon with the YMCA of Metropolitan Minneapolis. If you could come forward. Representative Norton, I'm sorry, you were on the list.
Thank you, Mr. Chair. I was really following up the last testifier, though my question really is to the audit team, I think, and that had to do with older adolescents, middle school and high school students. I guess I have read the overview but haven't read the entire document yet, and perhaps there's more in there, but if there is if that portion is missing from this, I guess I would like some clarification about why that was left out, as homeless teens are often coming from situations that seem to me could have been reported, and so I guess I'm a little curious as to that middle and high school population and how you treated that.
Ms. Meyerhoff?
Thank you, Mr. Chair and Representative Norton. We tried to, using the data, we tried to look at a statistical analysis to look at different factors that might affect the screening of individual referrals. And one of the things that we were going to include in our model was the age of the child. But unfortunately, the data are so incomplete when you start looking at the screened out referrals that we concluded we really couldn't report the results. We had such little data left over in the end that we weren't really comfortable with our results. So instead, we talked to agencies about how different factors and demographics might affect their screening decisions. And they talked about, at least in some cases, that because younger children tend to be more vulnerable and have fewer eyes on them, they might tend to screen in younger children more than they might older children. But we didn't hear that we don't screen in older children. I don't know if that really addresses your your question. It is something we were aware of as a concern, but that is really...
Representative Norton?
And Mr. Chair, and I guess that's a bit of a concern to me, and even though it's not listed in here, that should be a red flag of sorts, that you're not able to even have the data that would address this population as you do with the younger children. So, I'm not sure exactly what we do to address that, but, I don't know if you have any suggestions about if we need to collect more data or this screen in, screen out situation, if depending on how we choose to address that, it might give us more information moving ahead.
Mr. Chairman, I would agree completely that one of the themes of this evaluation is that we were stymied in some of our efforts to bring forth information to you because of the unreliability of the data. Indeed, I think the data and its quality has led some people on occasion to maybe make some conclusions that were not necessarily reflective of what was going on. So, I think we all would say we need better data for all kinds of purposes, for evaluation, for you as policymakers, for people within the system to more periodically than we do. We come infrequently to this to do an evaluation, but there are people out there in the department, in the county agencies that need to be monitoring this on a very frequent basis to do their own self-assessments. And so I think clearly there is room for increased quality of the data.
Representative Norton?
Well, thank you, Mr. Chair. And I think this is we've hit on something here that I think is very important. And I guess I'm not certain how to do it. But if we are screening out adolescents at a higher rate than we are children, which it sounds like that's perhaps the case, that might give us pause, and we might want to think about that for some of the reasons I think Representative McDonald was getting at. When you deal with adolescents, perhaps a different kind of, might be perceived abuse, perhaps more parent-child verbal, still could be intimidation or whatever. But if those are being screened out, I would certainly want to know that. And so I hope as we move forward, just as a committee, I'm not necessarily pointing the finger at you. You've done a great job of perhaps bringing to light something that we should look at a little more seriously. But that the committee kind of look at how, data collection is always an issue with this committee, and I understand that. But perhaps there's a hole here that we should think about filling somehow.
Mr. Chairman, if I might just say one other word on this. And, I think you heard it from the counties, but I think you're going to hear it again every time this issue comes up. And that is, they believe that the way this program, this responsibility, is structured in terms of who's responsible for what and how it's paid for, I think they are going to push back a little bit against the state directing them to set the priorities in their particular county. And, it's a policy question for you. Do you want counties with stretched resources to prioritize? And in their view, they may say, for the reasons Ms. Meyerhoff said, we heard. That is, if push comes to shove and we have to stretch these resources to the most vulnerable, we will pick the younger age children over those that are a higher age but still might have some issues and concerns. So, again, you're going to hear this from them. We certainly heard it over and over again. You saw the pie chart that shows who pays for this. So it's going to be an issue.
Could I make one other comment, too?
Sure, Ms. Meyerhoff.
Mr. Chair and Representative Norton, something that you had said reminded me that some agencies that are screening out referrals from child protection may be following up with some other resources. And that's not true for every county and every agency, but I know some of them have like parent-child programs where they do address some issues with parents and adolescents as well. So they might be doing something.
Perhaps we have a cause for a Representative Norton and McDonald bill coming forward, huh? Wouldn't that be amazing? Bipartisanship. I love it. You did, that's right. There was bipartisan legislation around. Next up, we have Charles Dixon, YMCA of Metropolitan Minneapolis. If Mr. Dixon could come forward. And if he is not available, Denise Graves with the Hennepin County Citizens Review Panel. Ms. Graves, welcome to the committee.
Thank you, Chairman.
Could state your name for the record and what organization you represent, and then proceed with your testimony.
My name is Denise Graves, and I'm here representing the Hennepin County Citizens Review Panel, although I'm also a volunteer guardian ad litem in Hennepin County, but I don't represent that agency here today. And I realize that I'm only reporting on some Hennepin County findings, so therefore, obviously a caveat does not affect the entire state, although from my understanding, the way Hennepin goes, so goes the state, because we represent the highest number of allegations. The couple things, and I want to thank Ms. Meyerhoff and the legislative auditors. I think it was a wonderful report, although I haven't been able to see more than the executive summary. We, as a panel, just recently completed our 2011 annual report, and as it happens, we were also evaluating intake screening, so that there was a lot of similarities, and our report will be, I understand, posted to the DHS website in the next week. The two things that we found that were very concerning to us and may affect the numbers that we see here, in a child protection intake, there are actually three categories that a call might be routed. One would be a screen out, which is really what was looked at in this particular audit, but the two other avenues are that a case was open for investigation, or there's a third track that's called family assessment, which was developed in Hennepin County as an alternative to court intervention, voluntary process, so that families can receive help from community agencies without a lot of the baggage, I guess, that goes with child protection intervention. The family assessment is considered a screened-in report. When we went to do a follow-up look at family assessments, we looked at the first 6 months, which was all the data that was available at the time, of family assessments, and found that 75% of those cases were never even offered services. From my understanding is it's a funding issue, that decisions have to be made and that we can't offer services to all those families. The problem being we are now counting them as numbers that are being helped by child protection, and in essence they are technically screened out cases because nothing is going to happen other than maybe historical data. The other issue that we saw was in screening, at least in Hennepin. Now Hennepin has fabulous workers. I am not here to denigrate anyone. It's a very difficult county, probably has the most problem cases, and have very long histories. And we were quite astonished to see in strictly rule-outs, not even family assessments, strictly rule-outs, the high percentage of cases that have history within child protection that goes back years. And that history is generally not even taken into consideration when they're deciding whether or not to screen out. It's based on the facts that came in that particular call. And if you're used to child protection, you know if it's a school teacher, they're only open to one child and maybe one particular circumstance without knowing everything about a family. So that if you're not taking in the history of, well, this teacher called about this child and this neighbor called about this child, and if you put everything together, we've got a problem. But because of the volume they have, unless it goes to supervisory review, it's based on that particular call and not on its history. One other piece of information that's just come to light that we had a real problem with is in data collection. We also find that there's such variance in the way information is collected that you almost cannot make decisions on an aggregate basis. You can get information on a case-by-case basis when you really delve into it, but when you want to look at something in the aggregate, like the older youth problem that just came up, we found that we could almost draw no conclusions because the data was so inconsistent from case to case. So we did make some very specific recommendations for DHS in their information. It's called SSIS, their reporting system. So that would, I assume, be statewide in ways that maybe that could be a little bit more uniform.
So, Ms. Graves, let me ask a little bit about that. So right now, if somebody calls in about Jane Doe being abused, there's no way to cross-reference for that person taking in that report that Jane Doe was mentioned in a report from some other entity?
Oh, there's a total way. I mean, they can look it up and they see an entire screen. It's a very cumbersome system, the SSIS system. So to be able to really go through and see what all that previous history is, something that's difficult for the screeners to do at that particular moment. So at least in Hennepin, unless it goes, if it's a questionable area and it's going to go for supervisory review, then they may go back into the history. But as a general policy, we were told that history does not count in the facts before them at that moment. And when we look at, we did a separate report on recidivism in child protection, and you know, I think it's the 80-20 rule. We have 20% of our families taking up about 80% of our funding, I believe. And so that if we could really get at the frequently encountered families and maybe look at them a little bit differently, we might be able to help. But funding is obviously a very big issue. And I guess since the state is only putting in 10%, maybe I could ask anyone here if we want to increase that funding to child protection, given how many of the Hennepin families are not even able to receive services that the county even believes need them, but we can't afford it.
Members, any questions of Ms. Graves? Okay, with that, thank you for your testimony. Please stay around close because there may be additional questions that come up as we're talking here. Next, we have Andrea Simonette, Catholic Charities. Ms. Simonette, welcome to the committee. Please state your name for the record and who you represent, and then proceed
Andrea
with your
Simonette.
testimony.
I'm with Catholic Charities, St. Paul, Minneapolis, specifically with the Hope Street Homeless Youth Programs. I've worked in programs that serve homeless youth for 18 years in Hennepin County, spending the last 10 as a program director for Catholic Charities. As a director of a shelter that serves runaway and homeless youth, we often work with young people who have experienced trauma and endured physical and sexual abuse. In fact, the majority of the youth that we serve at our shelter have been abused. As mandated reporters, we call child protection on all incidents of abuse, neglect, and mental injury. I am here to talk about how older teens, ages 15, 16, 17, interface with child protective services from our perspective, and how their age often serves as a barrier in them being protected. As budgets are cut, resources are pinched, and caseloads are increased, it is often the older teen population that becomes a lower priority than younger victims. This despite the fact that they are as vulnerable and as unable to care and protect themselves as their younger peers. These youth are extremely vulnerable to survival sex, exploitation, homelessness, dropping out of school, and chemical dependency issues. The result of older youth not receiving the protective services that they need is just as harmful to them and to society and our community as not protecting younger children. The result of this kind of prioritizing is a system that places a higher value on the safety of younger children than it does on older children. One major issue we see in reporting the abuse of older children is that they are penalized off it because they are able to take that initial step to get out of harm. They are able to run away and protect themselves in the immediate. But this action often leads them to not qualifying for protective services. Typically, the pattern that we see with teens is that they have enough resources to run, get out of the situation, and maybe make it a few days, a few months on various couches or friends' homes. But then once their very limited resources are drained and they find themselves in our shelter or another homeless youth agency, their bruises are healed. The response from protective services is that they cannot open a case as there are no visible signs of abuse. By responding this way, we are essentially saying that we expect the young person to stay in an abusive situation and continue to be traumatized so they can have fresh wounds on them when or if protective services is notified and takes on the case. It is as if we are punishing these young people because they are able to take that first step to protect themselves. But the fact is, just like younger victims, they are unable to maintain that safety. Youth like Maria, whose mother had been physically abusive to her for over 6 years, throwing objects at her, hitting her with cords and belts, pulling her hair, choking her, and banging her head against the wall. The last incident of abuse, Maria ran. She ended up with us a few weeks later. The case was not open because there were no longer signs of physical abuse. Another barrier in protecting these youth is a situation where the young person runs when there are serious threats of abuse, but before they are actually beaten. Protective services often will not open a case because it was just a threat and no abuse had occurred. This is despite situations where the threats are coming from abusers that have been documented as such by the system in the past. Take, for example, Hannah, who had been physically assaulted by her parents and brought into protective custody in July of last year. She was returned home after 5 days. 4 months later, her parents threatened to beat her again, and so she ran. She found her way to our shelter and stated that she was very afraid of going home. She was certain that she was going to get beaten again. When the call was made to Protective Services, we were told that she was considered a runaway, that she was not forcibly kicked out of her home, and she was not beaten yet. She had to go home. Again, we are penalizing the youth for being able to take enough control of their situation to get out temporarily. We have created a system where the youth must disregard serious and imminent threats in order to receive protective services. The definition of protection is the safeguarding of somebody or something, the act of preventing somebody or something from being harmed or damaged, or the state of being kept safe. A system that forces teenagers to stay in abusive situations so they have fresh bruises, or continue to live in a home where they are being threatened until they are actually beaten, is absolutely not protection. Thank you for allowing me the time to speak with you today.
Thank you for your testimony. Members, any questions? Very good. If you want to stay kind of close, Ms. Simonet, in case there are additional questions. And Kurt Laughinghouse. Is Kurt Laughinghouse here? Mr. Laughinghouse, welcome to the committee. Please state your name for the record and who you represent, and then proceed with your testimony.
Thank you, Mr. Chair. My name is Kurt Laughinghouse, and I'm a representative of Safe Passage, Minnesota, who's a member and executive director you met earlier. My wife and I, Ginny, and she's back home with a foster child, have been licensed foster parents since 1981, both of us. And we've cared for more than 100 children, and most recently, 17 of them are medically fragile. And that means what it says, that two children have died in our home. And we thought one of them, we never thought that child should have come to our home, but that's the way it worked out. But more than anything, I want to say this morning or this afternoon. What you are dealing with here, grossly, is the most important state function of the state of Minnesota. You all have budget considerations, political problems, and all of that. But it all comes down to this function of taking care of the young people in our state is the most important job that you have. And I appreciate the effort that you are putting into this job, and that you move from this meeting room to another meeting room, and come May you'll be coming in at 6 a.m. and putting some extra time in and getting the job done, maybe. I hope so. Nevertheless, I want to express appreciation, my own and that of our group, for what you do here. And if you want to call on us for any other information that we have, we're findable. And if you have any questions right now, I'm prepared.
Thank you, Mr. Laughinghouse. Members, any questions? Any questions? Yes, Representative Liebling.
Thank you, Mr. Chair, and to the testifier, thank you for being here. And, I want to thank you for all the care you've given all those foster kids. It just amazes me when I hear about people like you who do that. And obviously you have not shrunk from taking on some very difficult cases as well. And, since we're talking today about child protection, I just wondered if you had any particular experiences with child protection with any of the children that you've taken in that you think would be relevant to share with us today since you're here.
Mr. Laughinghouse.
I failed to mention that both my wife and I have and are currently active as guardians ad litem. But your question reminded me of a case that I'm working on right now, where there is it ties in with another one of the testifiers earlier. That there were 6 children in a certain family that I'm dealing with as guardian ad litem. One of the most egregious problem in that family was a teenager, a young teenager, who had sexually assaulted his 7-year-old sister. And I went back to, because I remember I had a thick notebook on this case, and I went back to the early pages, and this family had been in the system, as we all say, in the system, for 6 years. Mm-hmm. And that's not exceptional. It happens too much. And why is that? And how that just gives you all an idea of the resources that were expended. And I don't mean it was wasted. I mean that an effort was made to help these families, these parents and 6 children, for all that period. And a lot of money was spent. With regard to my situation or the situations with medical, we get excellent medical care and go to the new slick Amplax hospital down the street, and we're very happy with that kind of service. But it's harder even harder to get psychiatrists and psychologists to do the work that has to be done with kids who are really ill.
Thank you, Mr. Laffinos. Representative Liebling? Okay, members, I wanted to, first of all, is anybody else here who would like to testify? Again, I recognize that people have not had a lot of time with the legislative auditor's report. We hope that people will take some time to look it over. And if you have additional testimony or input or feedback that you'd like to share with the committee, to please forward that to the committee administrator, and we'll be sure to get that out. Understanding people haven't had a lot of time with it. Our next meeting, if there are no other testifiers, seeing none, our next meeting is tomorrow, Wednesday, February 22nd at 2:30 in this room. There being no other business before the committee, we stand adjourned.